I know enough about the surgery to be really scared. And I know enough about my disease and what I've lived through to be scared. Like, I don't want to live like this anymore. If I have the opportunity to change it.
Hey, I'm Kelly. This is my channel, Incredible Anyway, where I talk about how to live an incredible life, no matter what your circumstances. I've got bad vertigo, and I'm pretty miserable right now. I'm going to be having a telehealth appointment with my neurotologist, which is my Meniere's doctor. I am a person who's been dealing with Meniere's disease since 2010. I talked to him 3 weeks ago, but I wasn't symptomatic. Everything has changed. It's frustrating because what should be happening is I should be outgoing longer times between gentamicin procedures, and I'm not. Gentamicin is the least invasive treatment that I could do right now. And I think he believes that that has a high likelihood of killing the hair fibers. We're trying to kill those nerve cells. Nerve cells are in everybody's ear. They're supposed to be there, but in my ear, we have to kill them to stop the communication between my ear and my brain, because it's sending off these messages that are causing the vertigo. I think my doctor is of the perspective that we just keep doing the gentamicin until it improves. I'm miserable and I'm ready to get my life back, and I'm ready to make a decision to do something more invasive. I have talked about vestibular nerve resection here on my channel. It's a brain surgery for Meniere's disease. It is very scary. It's not anything to be taken lightly. They basically go into your brain and open up the dura mater, which is the lining, protective lining of the brain, which automatically can open you up to infection. It has a lot of risk, and it has a lot of potential side effects. It requires that you be in the ICU for a few days and then a regular hospital room until you can walk again. That's a really extreme procedure, but I'm there. I think if anybody would be a candidate for it, I would be. I only have my current insurance for another year, and then I won't be able to see this doctor after that, because the only insurance I'll be able to get is of doctors in the state I live in, and he's in Tennessee. If I'm going to get this surgery, it's going to be with him. I trust him. There is another surgery. I had it in 2011. It's called endolymphatic sac decompression. It only has temporary results. I went into Meniere's remission for 3 years, but I came back. Would I love another 3 years? Absolutely. But then what do I do when it comes back? If I have the opportunity to have the brain surgery now, I can say that it will be a decision that I will make that I don't want to make. I'm there, but whoever wants to have brain surgery, I don't. It's just scary. I have a messed up brain. My migraines are severe because I have a messed up brain. So to then, I don't know. I'm scared because I don't want to keep living like I am. And I feel like if we keep doing these gentamicin treatments, I'm just going to keep living like I am, and that's not acceptable to me. But I'm scared to do brain surgery. I'm so miserable and I don't want to live like this anymore. I feel like I'm in a situation I don't want to be in, because I was just really hoping that the gent would do it, and it's not. I feel like I know that if I get the brain surgery, that I have the best chance at, obviously Meniere's will be over for me, but what potential harm could I be bringing to myself by going into such an invasive surgery? So it's terrifying. I don't know what I want. I just know I want to feel better, and I think this is happening to me. I know other people would say, get the brain surgery, Kelly, get it over with. But this is my brain. I have to live with it. I have to go through this surgery. I have to go through the recovery. I have to go through the consequences of what if something goes wrong. It's your brain. It's not like your leg, Oh, they f up your leg. Oh, they screw up your leg. Oh, you have to get it amputated. That's a big deal, right? Of course, that's a huge loss. I'm not saying it isn't, but you could still think. You could still function. You could still, your brain is just a big thing to mess with. And I don't want to do that.
but I don't feel like I have a choice anymore. And I feel so alone in having to make this decision because I know other people want me to do it. Like, I know that if this choice is given to me, the other people will say, well, it's a freaking no-brainer, Kelly, do that. But I have to look out for myself, and it sucks I'm alone in that. At least I feel alone. I'm making myself sicker. I know that people who love me and care about me want the best for me, and I don't question that. I don't think that they have any malintent, but it's not black and white. I'm not looking forward to this conversation. I mean, my doctor's phenomenal. I'm stressed. I feel like I know enough about the surgery to be really scared, and I know enough about my disease and what I've lived through to be scared. Like, I don't want to live like this anymore. And if I have the opportunity to change it, I don't know that I would ever get to a place where I wouldn't be scared. I think that it's healthy to be scared of something like this. And I think at some point I would get to a place where I go, okay, like, I'm doing this, and the outcome is not in my hands. It's in my doctor's hands and in God's hands. It's just really heavy.
You are not alone in this world. You are not alone. You are not alone in this world. You are not alone.